let Dr. Kazzi introduce himself. Thank you so much for being here, Dr. Kazzi.
It's my pleasure. How are you all doing today? I'm glad to be engaged continuously with UAB through Dr. McCormick and Ms. Kidd and Navavi and others. So I'm no stranger to Alabama, and I'm really interested too in y'all's initiative, because I have two kids that are at elementary school in Atlanta, and you know, I was horrified the day I went to Target to buy the supplies that were you know, requested, and I wondered, I was like, how come my school is not asking me to come and talk about this? Because they know I'm a toxicologist, and I keep, you know, saying hi to the principal every day, and happy to help him if they need anything. But your initiative and curiosity about this, I think, is very well, very appreciated, and I think very relevant. Congratulations on having this initiative to learn about this. So I want to chat with you a little bit. I invite you to unmute, and don't worry if you want to just talk about it instead of just going through a lecture, and you know, interrupt me, and let's chit chat about these commonly used disinfectants at schools. You know, and I think the key thing here is to use them appropriately. That's where you are safe. And if you don't use them appropriately, that's where you're unsafe. And I want to make sure that you all know how to use them appropriately. So I'm an emergency physician, so my ER doctor at Grady, but I'm also a medical toxicologist, and I've worked quite a bit with a variety of issues in toxicology. Some of them are environmental or occupational. So I run the occupational toxicology clinic at Grady. So I work clinically in the ER at Grady in the trauma center, but I also work in a clinic. And I see people in the clinic, they're exposed to chemicals at work or in their environment. I've also done some work with the CDC in Atlanta, primarily in radiation emergencies and chemical terrorism, that kind of emergency preparedness work. I've intersected with UAB for years, since 2005, and it's been a pleasure, like I said. With this topic of disinfectants, I'm funded by the American College of Medical Toxicology, that received funding from the American Academy of Pediatrics through the Pediatric Environmental Health Specialty Unit, which is also called PACEP, Pediatric Environmental Health Specialty Unit, which for Alabama is based out of Emory University here in Atlanta, because of the ATSDR region you belong to. So you are part of the Region 4 PACEP. And PACEP programs around the country have received a grant from the US CDC and EPA, or specifically the ATSDR and EPA, to fund this program on the safe use of disinfectants. So that's where I started working on this in a more specific, focused manner. My work with ARC IPC has been also a recent addition to my my profile, and it just happened that there was you know, a overlap in the interest and mission of these two programs. So I'm going to kind of share with you some of the work we've done with the PACEP grant through the ACMT, and then we'll talk a little bit about the disinfectants that you are using. You know, certainly an epidemic that became a pandemic, you know, with this virus, was a natural, you know, setup for all of us using two things, you know, disinfectants and sanitizers. And certainly at the beginning, you know, of this horrible tragedy in our world, we, you know, were using more probably disinfectants. I think at the outset, we were extremely concerned about the fomite transmission of these of the virus, and of course, healthcare providers were scared of contracting the virus. There was a paucity of personal protective equipment, PPE, gloves, masks, and we were cleaning, reusing the same material. So that whole topic became a part of our daily routine multiple times. The one lesson that I learned from toxicology and public health is anytime you have an emergency that leads to a overuse of something for prevention or for therapy, you can expect that there will be accidental exposures leading to toxicities and poisoning in the community. You should also expect some intentional exposures too. So the fact that we were all using these chemicals led to the expected consequence of an increase in exposures to cleaners and disinfectants leading to toxicity, as reported to the poison centers of our nation and the American Association of Poison Control Centers as early as 2020 was reporting on this in its mortality morbidity weekly reports. As you see in those two graphs, the significant increase in exposures to cleaners and disinfectants. And that's not surprising. And if you see another epidemic one day with another therapy or preventive strategy, you will see these exposures go up. These are all primarily accidental, but some of them are also intentional. We'll talk about some of those in a little bit. So let's make sense of these chemicals. People that have careers in infection control, they use the Earle Spaulding classification. I'm not just throwing this at you to use medical jargon, but I think it's important for us all to get on the same page that the level of disinfection needed, dictates the chemical you use. And the level of disinfection needed is dictated by the critical nature of what you are cleaning. So if you are cleaning a device that is meant to be inserted in someone's heart, let's say a valve for a heart valve replacement, or a pacemaker, this is a critical use. This is a critical device. This is inside your heart cavity and your vessels. For example, if it's a stent, let's say for a heart attack, those need the highest level of disinfection, right? These need sterilization. And that's a whole different world of processes that you don't need to worry about. If you are using semi-critical devices, those that are in contact with mucous membranes or skin that is open, non-intact, then you also need to be careful and have a high level of disinfection. Think, for example, of a OBGYN nurse inserting a speculum inside of a vaginal, inside of the vagina, for example. That's an example. Think about something that is going into like a anoscope for a gastrointestinal doctor. Those require high level of disinfection. But what you all do in the school is really a low level disinfection in your situation. Because what you really try to do there is clean non-critical surfaces that are not coming into contact with open skin or mucous membranes, and certainly not entering the body like a device that is used as a pacemaker, for example. So our goal is low-level disinfection. And we can argue about the mode of transmission of SARS-CoV-2 and the fomite versus aerosol. Certainly now, it is less emphasized to be a fomite contamination. Rather, transmission via aerosol is the primary, more important route. So we don't need to worry about these specialized sterilization methods that are used at hospitals, like steam or ethylene oxide, or some highly concentrated and effective formulations of hydrogen peroxide. We don't need to worry about that, because we're not trying to kill the whole range of organisms that can be out there. Because sterilization really is the top of the top, and that can take care of spores all the way to SARS-CoV-2, which is on the bottom, on the easy side of that scale. SARS-CoV-2 is an enveloped virus that is easier to kill or deactivate than bacteria, than fungi, than non-enveloped viruses like norovirus, than mycobacteria like tuberculosis or spores. If you were dealing with all of these types of organisms, then sterilization would be a must if you were worried about getting infected by spores. Same thing, we don't even need high-level disinfectants, because those chemicals you see here at these concentrations are going to also take care of everything listed, except maybe the spores, not as good as the sterilization. But again, we are not looking for that. We are looking for low-level disinfection. We are looking at bacteria and enveloped viruses like SARS-CoV-2. We're not trying to clean norovirus. We're not trying to clean fungi, mycobacteria, or spores, because the surfaces we are cleaning are non-critical. Non-critical because they don't get into contact with non-intact skin, mucous membranes, or they don't enter the cavity of the heart. I want to point out one thing here. You'll see hydrogen peroxide showing up here under sterilization, showing up here under high-level disinfectant, and you will also see it again as a low-level disinfectant. This is really an important concept for you to grasp right now at the beginning. What defines some of these chemicals is the concentration and delivery method. So don't think that hydrogen peroxide that you use in the school is dangerous, like, for example, these hydrogen peroxides that are used for high-level disinfection or sterilization. It all depends on the concentration, as well as the physical form or method of application. Flip this the other way. If you use one of those chemicals that are supposed to be recommended for low-level disinfection, if you use it inappropriately, it can lead to severe toxicity. So the magic idea here is, what is the concentration that you're dealing with? What is the chemical that you're dealing with? How are you supposed to use it safely and using it that way? If you pay attention to these items, you will not run any hazard of significant toxicity from using these over and over again, like you do at schools and workplaces every day during this pandemic. And when we look at these low-level disinfectants, examples here are, of course, ethyl alcohol. Yes, alcohol, greater than 70% concentration, so quite concentrated alcohol. Isopropyl alcohol or rubbing alcohol. Chlorine, phenol, iodophore, like iodine compounds. Quaternary ammonium compounds. Again, hydrogen peroxide, but look at these low concentrations of hydrogen peroxide. And peracetic acid. And chlorine, when you see chlorine here, think about sodium hypochlorite and bleach. So when you are shopping for these chemicals, what is it that you're trying to achieve? What is a good disinfectant? You want the antimicrobial spectrum to meet your need. Our need is SARS-CoV-2. You want to kill rapidly because typically we want to do something quickly. We want to clean it and use it. We want it also to be a chemical that's not going to evaporate right away, because if it evaporates right away, it may not have enough time to kill the SARS-CoV-2. You have to think about its physical properties too. Is it going to be able to penetrate through a thin layer of dirt on top of the virus on the table? Is it going to be decomposed rapidly by the sun if you are applying it on a bench outside the school? You want to be safe to you when you apply it. You want the smell to be acceptable. You want it to be reasonably priced, so you don't, because you use a lot of that stuff, and sometimes there's waste, and it can be like a very expensive product. Ideally, it'd be nice if it's soluble in water and stable in a concentrate or in the used solution, so that you can be able to use it again from a container and reconstitute it if you need to in a more dilute form without it decomposing in that container. Of course, you don't want it to be flammable. Anything that's flammable is always risky. You don't want to be corrosive to the table or to the the devices surfaces you're applying it to at school. And you kind of want it to be sticking there around for a while, if you can. If you have something that can stick around for a while, that's ideal, but those are really hard to come by and use, especially in a school setting. But there are some persistent disinfectants that you can apply, and they can provide disinfectant status for several hours. So what are some essential steps when you are using this? This is something that I actually discuss frequently with my wife. My wife is, of course, like everybody else, these days, a dedicated, cleaner of the house with disinfectants, and she, uses quite a bit of bleach in our house and quaternary ammonium compounds. Okay, so I wanted to make sure that she knew all these steps. And I hope that you all know these steps as well. And if you don't know these steps, this is important to know. And if your colleagues are not aware of these, this would be an essential message to take away from this discussion today. I don't know if people knew that you have to clean the surface before applying a disinfectant. You may or may not know this. I don't know. I could certainly imagine some people not knowing this. Why is that? Because dirt is organic sometimes, organic material, and can react with your chemical that you're applying. And that can lead to vapors that can be toxic. The other reason why you would apply, while you clean first, is because a virus can be hiding under that dirt, and your chemical may not reach it. The dirt can be a physical barrier for the contact of the chemical with the virus, and therefore killing the virus will not be as successful as if you had cleaned first. The other elephant in the room is optimizing space ventilation. I come home, go to the bathroom, and it smells like a chlorine factory, like a swimming pool, after my wife has been there with the disinfectant. What can I do? It's a bathroom. I don't have windows. I mean, I have windows, but there's some of those windows that don't open up. I open that ventilator in the ceiling, but how efficient is that ventilator? So, remember, there are some schools that are in up north, they're probably colder, right? Cold weather. So that'll be an issue, right? Especially if you're using AC or if you're using, so ventilation is your best friend here too. Remember that. How often do you use gloves and goggles to do that, to clean the surfaces? Have you wondered about that? Let's not talk about the goggles as much. Let's talk about the gloves. Do you always use gloves? I'll tell you, I agree with you. You probably do, but we don't in the ER. You know why? Because we put on the gloves, we see the patient with COVID, we get out of the room. What are we gonna do? We're gonna take off that glove right away. We have the stethoscope, and we have this bucket that has these bleach rolls. You gotta pull that bleach roll out, clean your stethoscope. So most people are in a hurry. They don't want to put some new gloves on and then clean their stethoscope and then put the stethoscope and let it work on it and then take off the gloves. So often what we do is we just expose ourselves to the chemical, clean a little bit, and then go wash our hands. Goggles are more important, if you have a splash, or if you have like something that's going to be vaporizing the air. And actually here, that brings me to the next important comment. Be careful with spraying. People should not spray the chemical on the surface. People should spray the chemical on a rag and then apply the rag to the surface. My wife runs around with that bottle like a gun, and she like sprays the entire table. What does that do? That vaporizes all that chemical in the air that's now going to be inhaled by me, by my kids, by her. And that's important, especially with chemicals that otherwise are not going to vaporize on their own. For example, quaternary ammonium compounds, they don't vaporize, which is great. But when you spray them, you're making them airborne. Also, there's something called contact time. which is kind of like the elephant in the room. Like nobody wants to admit there's a contact time because we want to move. But yes, it needs 3 to 4 minutes. Are we waiting 3 to 4 minutes? We gotta wait. We gotta follow the instructions, and they vary. Some of them are longer. Again, that's gonna depend on the concentration and the formulation and the potency of the chemical. So there's one slide to keep at heart is this slide. And this PDF that you see, this image, is a free PDF you can download. It's also available in different languages, provided by the Pediatric Environmental Health Specialty Unit that we are working with. All right, so we finished the basics. Let's move on to some of the other things that you may have some parents come and talk to you about. Some parents may come to you and talk to you about these safer disinfectants. Let's talk about this. Now, luckily for us, the EPA has a list of disinfectants and classifies them as safer choices. But there are also these DFE certified disinfectants. These are basically designed for the environment. So these are disinfectants that have less environmental impact. So people that are concerned about the long-term impact of using a chemical in the environment, on the environment, are gonna wanna look at this DFE certified disinfectants. Within that list, you'll find bleach, you'll find quaternary ammonium compounds, but you'll also find some safer choices. Okay, these less toxic choices include citric acid, dilute hydrogen peroxide, L-lactic acid, and ethanol. The more toxic DFE certified compounds are chlorine, bleach, quaternary ammonium compounds. And again, hydrogen peroxide is going to straddle both the less toxic and more toxic, depending on the concentration that you use. The issue with these less toxic compounds is that they're more expensive. And they are, yes, they're better for the environment. And they are safer in terms of some of the repeat use exposures, toxicity. But I want to tell you though here that if you use bleach and quats appropriately, quaternary ammonium compounds appropriately, we're gonna call those quats, you'll be fine. And we gotta talk about how to do that. But you can look up your chemical. I invite you to go to that website and put in, you're gonna have these slides, and you can put in your chemical, see what you're using, and see what it says. Let's start with the quats. The quats is what my wife recently bought to send with my kids to school from Target. And quats are interesting because they have an ammonium compound. So, you know, in the structure, you see this ammonium compound in it. And they have one of the largest share of the market. And of course, they come in a variety of forms. And they can come in wipes, they can come in sprays, they can come in liquid. And again, a major player in our pandemic, the production in May 2020 alone was equivalent to the production in the entire year of 2019. Some of the names that you may see are benzalkonium chloride, benzethonium chloride, alkyl dimethyl benzyl ammonium chloride, these long chemical names. Whenever you see ammonium chloride, think of a quat. Okay, and you see there's a variety of products. The reason why these are tricky is because they are skin sensitizers. They're bad for your skin eventually. They can sensitize your skin, develop dermatitis, allergic dermatitis. This is why it's important to use gloves with these more than it is with bleach. And you may not know that. I would say use gloves with both, but if you were gonna, you know, pick gloves for one scenario, I would certainly pick it for this versus bleach. Okay, and don't aerosolize it because it can also sensitize your lungs. If you inhale it, it may cause an asthma exacerbation and potentially cause asthma in somebody who's not asthmatic. This is not as solid as an evidence of causing asthma, but certainly exacerbating existing asthma is proven. The good news about this guy is that it doesn't vaporize a lot, unless you vaporize it yourself by spraying. So that's good news about it. Okay, but again, you have to apply it better with the rag directly while you're wearing gloves. Give it some time to kill, and make sure you use it in dilute, the way the manufacturer is telling you to use it. In some rare cases, somebody can overdose on this. They ingest the liquid, and again, it's going to be an irritant. It's going to cause burns. Depending if you ingest it and drink it, it can burn your esophagus and stomach. It can cause some other severe effects in overdose. And we don't need to worry too much about this in our scenario. But yes, say for example, a child goes into the closet cabinet and drinks something, then you may deal with all of these caustic injuries. The more important topic for our discussion today is thinking about the chronic issues, because you're using these for a year, 2 years, repetitively. What can happen? And yes, for the skin, it can cause these contact dermatitis. That's why it's essential to use gloves with these. The chemical will bind to compounds in your skin, will create an immune response, and upon re-exposure, you'll develop the rash. And some people are allergic to this. And there are patch tests that can be done by allergists for these quaternary ammonium compounds. From a respiratory perspective, does it cause asthma? Does it exacerbate asthma? That topic is a little bit controversial as far as causing asthma in somebody who's not asthmatic, but certainly an asthmatic person can get an exacerbation if they inhale this. Again, the good news is you don't inhale this because it doesn't vaporize unless you vaporize it yourself. But again, bleach and quartz are certainly potential for exacerbation of occupational asthma. Okay, how do you treat these asthmas? You treat them the same way you treat asthma, with steroids and bronchodilators, inhalers. Are there any issues with pregnant women as well as breastfeeding women? The short answer is no, non-proven. Animal studies that shown this have been given very high levels of these, not what you get by using these every day to clean. And they are usually better for the environment than some other more dangerous chemicals, but still there are some concerns with some of their environmental impact, but certainly still listed on the design for environment list by the EPA. But again, remember, spraying this can make it bind to dust, and you can inhale that dust, and that can cause some issues with the lungs. Moving on to bleach. This is the water-based disinfectant, very commonly used in childcare settings. And the concentrations will range. And sometimes you may have to dilute it at your school. So bleach is not that bad. So let's talk about bleach a little bit. If you're buying concentrated bleach to prepare it at your school, for economic reasons, it's okay. But you just have to be careful when you mix it up. That act of the person who's doing that needs to be in a ventilated area, needs to be wearing gloves, goggles, and a mask, like a regular mask is fine. And again, you have to have your dwell time. And you saw here, Cindy, the concentrations 0.5 to 2%, depending what you're trying to achieve. But those concentration gradients will actually take care of SARS-CoV-2. Okay. But there are ways to use a closed dilution system to go from a concentrated compound to a less concentrated compound without exposing the operator by using a closed dilution system. And bigger issue here with this than quartz in terms of reaction with organic matter, leading to production of other chemicals like carbon tetrachloride or chloroform that can be carcinogenic, can cause cancer. So you worry about those a bit more than you would. Now, bleach also can cause severe injury when ingested in large quantities. Nothing to worry about in these small quantities. It can also cause burns to the eyes if it splashes the eyes. This is why it's good to wear goggles. And most important, and something we see occasionally, is especially in the house, at homes, a cleaning person at home will mix two chemicals together, and that's dangerous with bleach. If you bleach if you mix bleach with ammonia, and I've seen people do that to clean the toilet, you release chloramine, which is a very toxic chemical. If you mix bleach with acid, like hydrophosphoric acid or hydrochloric acid, you can release chlorine gas, and those can cause significant lung problems, lung inflammation, and severe lung injury. So mixing chemicals is a no, no, no. But people do it sometimes. I don't know why. They feel like it's okay, or give them a better cleaning action. That's dangerous. And also adding the bleach into a toilet that has organic matter in it still, hasn't been flushed, for example, may cause issues as well. But from a skin perspective, it is less a sensitizer than quartz, but more of an issue for respiratory effects. If you combine it to organic matter, it vaporizes more than quartz. It can cause asthma exacerbation. And again, these people that are exposing themselves to these can get some direct effect on the skin, but also they can have effects on the skin anyway, because they're washing their hands a million times a day. So their hands are dry, cracked up, get infected, get irritated by the chemical, and can cause some chronic dermatitis conditions. So keeping the hand hydrated with emollients and creams is essential. And finally, again, remember, bleach can exacerbate asthma. Some people think maybe it causes asthma. Also, the judgment on that is out. Some people will say probably it can cause asthma in a non-asthmatic. There's some studies in people that work at swimming pools or work with bleach all the time that have developed asthma, but that evidence is non-conclusive. Bleach itself is not known to be a carcinogen. However, its products, when it mixes with organic matter, are possible carcinogens in humans. And finally, you have your hydrogen peroxide, which is another one that you may see in your environment. Hydrogen peroxide can be very dangerous if it's concentrated. If you drink it, it can cause oxygen bubbles, and can cause oxygen emboli, air emboli in your body. It can be very dangerous that way. But what we use it in most scenarios are very low concentrations, 1.5 to 0.5% solutions, and those are not dangerous. We can even gargle with it in our mouth. Some dentists may give us these low concentrations to gargle in our mouth. So the key with hydrogen peroxide is realizing what we are using, what concentration we are using. But this one, again, can be problematic when you have these highly concentrated compounds that are purchased as bulk to save money, for example. They can lead to air emboli in the liver, in the brain, so pretty bad when that happens. But again, it is listed on our EPA list in its dilute form. And typically, when you use it chronically, it can cause bleaching of the skin and irritation again. So wearing gloves is important. It may cause some respiratory irritation, but it's not a carcinogen as far as we know. And just be careful that some of these products have additives that can cause their own toxicity. So looking at the label, learning about what you're using and what these individual ingredients can cause is the safe way to do this. So here's a summary at the end of what we talked about today. We talked about quartz, bleach, and hydrogen peroxide. Most importantly, we talked about how to safely use these chemicals by ventilation, gloves, goggles, not spraying them, applying them directly on a rag, then cleaning, leaving enough time for dwell time and kill time, and of course, following the label and preventing inadvertent acute exposures by storing these safely in a closed cabinet. Again, I think this was great to spend some time with you. I want to leave the rest of this period we have for some questions or interactions. And I hope you really thought this was useful. If it's not useful, please let us know, because Elena and I will probably have more of these next year.